the benefits of HRT. So benefits of HRT. Benefits of HRT, there's a lot of different things it's going to help you with. Like I said, sleep. It's going to help with energy. Should help with recovery, lean muscle mass, feeling of well-being. That means feeling good about yourself again, the confidence back. People lose that confidence about themselves and they think, why? Why am I broken down like this? Why do I feel like this? I don't know why I feel like this. And they feel like I'm depressed. I just don't know what's going on. I'm not myself. That's probably why. Have you blood tested and see where your hormones are at. And don't let a normal doctor tell you, well, like everything came back normal. I just went over this today with one of my tight nets. Now, normal on a testosterone total test from LabCorp is 264 to 916. That's what the reference range is. It's such a big reference range. So if you come back at 265, you are within normal limits. I don't care if you're 18 years old or you're 80 years old. You're normal. I don't care. No deficiency, no testosterone for you. I don't care how you feel. Here's some Viagra. Here's some antidepressants. I'll see you next month. Have a good one. All right? So that's not the way it should be. So you want to have optimal levels, right? Especially if you're younger. Usually younger, and we talked about this too. 18 to 21, you should be feeling your very, very best. That should have been your rock out years. Hormone-wise, testosterone-wise, you should be at your very, very peak. And then every year after that, you're going to start going downhill. And it's just a decline, and, you know, we basically, we die. You know, we go through our dying stages. It's just a slow death. You know, I hate to think of it like that, but that's what aging is. It's just a slow death. So we wither, we die. I think of flowers all the time. They go through their awesome blooming process. They look the best at that point, and then after that, they start withering, and they die, and they're gone. So it's just a circle of life. You gotta love it. But we want to keep you as young as possible if we can. Look at Art going away on the background. All right, so so HRT, many benefits. All right, and we're getting more and more research out there that is showing more and more benefits. So all those myths about cardiovascular problems and all that, those are starting to become myths themselves, because we're starting to see that it doesn't cause cardiovascular issues and such that all these doctors are so problematic about, even prostate. I just posted in our preventative medicine group an awesome research about post prostate cancer survivors going back on testosterone replacement therapy and actually helping them out. So it's really controversial, especially with older doctors and younger doctors, more cutting edge. They're going back and forth, but the research is starting to be there. And we have to think about it logically. Think about this logically. And this is the fact too, that most prostate cancer people, men, because men only have prostates, at that point, those guys have low testosterone, we're deficient for testosterone, and they have prostate cancer. Now, we think about young guys, right? 18 to 21, we just talked about that block. Those guys are at their peak of testosterone levels, the highest it's going to go. Now, were they healthy or were they not healthy? Did they have prostate cancer or not? No. That's what I'm saying. If you're at your healthiest and you have the highest peak, at that point, when you're at your oldest, you shouldn't be at the lowest peak. You should be right in the middle, and it just depends on your age and what else is going on. If there's some serious issues health-wise, testosterone replacement therapy might not be for you. So it's not just for everybody. I want to make sure that we're clear on that. I mean, I think it does wonders for males and females and all these different aspects, but some people, it's a scenario-by-scenario case, and it might just not be for you. Not to say that we don't have other therapies for you, though. That's the cold hard facts. Hercules Potion, Tight and Complete, ECA Stack Plus for some people. It's awesome.